Hey, did you hear about the new patient I'm treating?
No, what you got?
HIV!
HIV?
Don't worry, you don't get it that way. HIV can only be transmitted to another person by blood or other body fluids. It's a virus that is spread through high-risk behaviors, including unprotected sexual intercourse and sharing needles, such as needles used to inject drugs and those used by tattoo artists. People who have other STDs are at greater risk for getting HIV during sex with an HIV-infected partner. If a woman with HIV is pregnant, her baby can catch the virus from her before birth, during delivery, or from nursing. If doctors know a pregnant mother is HIV positive, they can usually prevent the baby from getting it.
Come to think of it, I did a little research on lentivirus. It attacks the immune system. HIV is a lentivirus, what?
Why, yes it is. The history of the human immunovirus, HIV, and the acquired immunodeficiency virus syndrome, AIDS, dates back to 1981. Homosexual men with a symptom of a disease that are now considered typical of AIDS were first described in Los Angeles and in New York. These men had an unusual type of lung infection called pneumocystis carinii, a rare skin tumor called Kaposi's sarcomsas.
I remember there was something that all the patients had in common. There was a severe reduction in CD4 cells or T cells in the blood, which fight infections.
People typically get HIV and AIDS confused. HIV is a virus that causes AIDS, but people can get HIV and not have AIDS. Some with HIV virus get serious infections they normally wouldn't. That is, they become immunodeficient. They have AIDS or acquire immunodeficiency syndrome.
How can you prevent the transmission of HIV?
It can be prevented by abstaining from sex, always using latex condoms for all types of sexual intercourse, never sharing needles, avoiding contact with body fluids, like wearing gloves in the hospital.
HIV is really dangerous because a person can have it and not even know it. It has no symptoms and they can pass it to another person by risky behavior.
That's correct.
Didn't Rock Hudson have it?
You mean that old famous movie actor? Why, yes. He had HIV and developed AIDS, and eventually died from it. Another famous person is Magic Johnson.
That's right, the famous NBA basketball player did have HIV. He was diagnosed in 1991, but has never developed AIDS. Magic Johnson had a great impact because it made people realize that you didn't have to be homosexual to get the disease. He's been a great spokesperson for HIV and AIDS. He made people realize that anyone could get it, and he talked about how important it was to prevent the spread of HIV.
Johnson became an effective ambassador for HIV and AIDS education and prevention. Just being Magic made people view the illness more humanely, and his relative good health for 20 years after being diagnosed serves as an inspiration for those who are HIV positive today.
HIV and AIDS are among the most dangerous and serious diseases in human history.
There's an estimated 42 million people living with HIV and AIDS worldwide. Over 3 million people every year die from this deadly disease.
Drugs have been successful in slowing the process of the disease, and people with the disease now live much longer, but there is still no cure for HIV and AIDS. Even though we are young, we are still subjected to the dangers of drugs, tattoos, and sexual intercourse. It is important for us to learn about HIV so we can prevent getting it in the future.
That's far from the